Hi, my name is Jennifer Hinke. I'm the laboratory manager here at the Coachella Valley Mosquito and Vector Control District. This video is about the district's mosquito-borne virus surveillance and emergency response plan. West Nile virus is a disease that is detected annually here in the Coachella Valley. Mosquitoes can pick up the virus from infected birds and transmit it to healthy birds. If an infected mosquito bites a person or a horse, they also can become infected with West Nile virus. Mosquitoes cannot pick up the virus from a person or from a horse. St. Louis encephalitis virus is also detected here in the Coachella Valley each year, and it has a very similar life cycle. The district conducts our work using an integrated vector management program. This means that we use a science-based approach to control the mosquitoes and other vectors. We conduct surveillance to determine where and when the mosquitoes and the viruses are present. We educate residents and property owners on how to reduce mosquitoes where they live, work, and play. When the conditions are right, the control is needed. We use a variety of techniques. We use physical control, such as removing standing water where mosquito larvae can live. We use biological control, putting mosquito fish in areas where standing water is appropriate. And we use chemical control, using the appropriate control products, targeting mosquitoes where they live and are active. The district reviews the California mosquito-borne virus surveillance and response plan and adapts it to be specific to the needs of the Coachella Valley. This plan outlines how we carry out the surveillance for mosquitoes and the viruses they can transmit, what control options are available to us and which ones we use, how we communicate the risk, and how we coordinate our work with other agencies involved. The district risk model includes 5 factors that impact the transmission of West Nile and other viruses. These are the number of virus-positive mosquito samples in an area, the abundance or the number of mosquitoes which can vector or transmit the viruses, the average daily temperature for the previous 2 weeks, the number of dead birds that test positive for the virus in an area, and the number of people who have tested positive for the virus. Each of these is given a score, where 1 is considered to be low and 5 is considered to be high. We average these 5 numbers together to get a final risk level for the area for the week. Here we see an example of the risk values for areas of the Coachella Valley. If the overall risk level is between 1 and 2.5, we are in normal season work. If the risk level is between 2.6 and 4.0, we are in emergency planning level. And if the risk level is between 4.1 and 5.0, we are seeing active transmission and are in epidemic conditions. For this example, the risk of virus transmission is highest in the eastern Coachella Valley communities and in some of the cities, and this means we would begin to focus our work there to reduce the risk. I'll describe more in our next slides what we mean by focusing our work. The district has the most ability to impact the number of virus-positive mosquito samples and the abundance of those mosquitoes. If you are hearing that we detected virus in mosquito samples, or that we are conducting adult mosquito control operations through the news, social media, or from neighborhood signs, this is a sign that we are responding to high values for these 2 factors and are actively working to reduce the virus risk level. What does this look like in practice? Well, in normal season, the Surveillance and Quality Control Department sets traps at a variety of locations throughout the valley. These mosquitoes are identified to species, and samples of the mosquitoes that can transmit West Nile or St. Louis encephalitis virus are tested. In operations, employees called vector control technicians look for places where standing water are, and they make applications of control products to reduce the mosquitoes. Our public outreach department gives presentations to residents and visitors to the Coachella Valley to inform people on how to not be a mosquito source and how to appropriately wear insect repellent. When we do detect West Nile virus, or when the mosquito numbers are high, we are often in emergency planning level of virus risk. While continuing the work of normal season, we add work across the district. The Surveillance and Quality Control Department sets extra traps around traps where mosquito samples have been positive for virus. We also check the efficacy of the products that we will use to control adult mosquitoes, so that operations can use the most effective ones for us. In operations, our vector control technicians will move from routine work to focusing on areas where virus activity or on areas with high mosquito populations. They use our internal system to see known mosquito habitats that need to be checked. They post disease warning signs at intersections and entrances to communities. They also look for areas of non-flowering plants where an application can be made to target mosquitoes that rest on those plants. Our public outreach department increases their communication to the community, targeting the same areas where virus or mosquito numbers are higher. They spend more time reaching out to and educating leaders and residents in those neighborhoods. During this time, virus level can increase, and we may be making additional responses. Typically, these are in the form of adult mosquito control operations. Depending on the neighborhood or area, we will make applications of adult mosquito control products in the evening or in the morning before sunrise. We make these by truck and by helicopter, depending on how much virus activity and mosquito activity is in the area. We also reach out to city, county, and community leaders directly to spread the word on how to help us reduce the mosquito population and how to prevent people from being bitten by mosquitoes. Public outreach shares this information by press releases, resulting in TV, radio, and newspaper stories. When we do reach epidemic conditions, the work of normal season and emergency planning continues. Often the trapping, treatments, and outreach is pushed to its highest levels, and priorities are reconfirmed by discussions of the department leaders. Behind the scenes, the district managers will be having discussions with county, state, and other mosquito control districts to coordinate our efforts. We have ongoing discussions with our vendors to ensure that the supplies can be replenished, and we partner with the county to ensure that the medical community, that is our doctors, nurses, nurse practitioners, and others, recognize the symptoms of these viruses so that the patients can be treated quickly. Thank you for viewing this video. If you have questions or if you need service for mosquitoes or vectors, please reach out to us by phone or by email. Thank you.